Hello, I'm Mario Toneguzzi, Managing Editor of Canada's Podcast. Joining me today on Calgary's podcast is Dr. Anmol Kapoor, who is founder and CEO of BioArrow. Thanks for joining us today, Doctor.
Thank you so much for having me, Mario.
All right, let's talk a little bit about BioArrow. Tell me what it is and what you guys do.
Well, Bio is a one-of-a-kind company. It's a global company. It has 4 different verticals. What it does specialize in is specializes in precision health. So far, the healthcare has been a hit and trial approach. So me as a cardiologist, practicing cardiology in Canada, often we don't know if a person may respond to an aspirin, if they're having a response to a statin, and if the medication we're giving are the right medication in the right dosages. Or sometimes we don't even know why some people develop a heart disease prematurely and why some people develop a heart failure without having any blockages. Many times we call them as idiopathic. We have no idea. So I call it doctor is an idiot and patient is pathetic. We just don't know sometimes. So that's the puzzle, the piece of the puzzle. When we never knew why the problem happened, we call it autoimmune or we call it idiopathic. We solve that problem. So we uncover the secrets from your DNA, secrets from your microbiome, and we secrets from your various metabolic pathway, could be proteins, could be hormones, and understand why you have the disease, what could be coming next, and how we can help you live longer or perhaps have a healthier life. So we have a lab to help solve the problem. Then we have a software solution. We are a technology company, biotech company, and then we have a clinical side. And the clinic we have is in Calgary. Then we are looking to launch our clinic in Dubai, in UAE. That'll be the world's first precision health and longevity clinic to help people live longer and find ways to stay healthier longer.
Tell me how you got into this.
Well, the common problem was always patient coming to me, Dr. Kapoor, I'm 40-year-old. Why did I get a heart disease? Why have a blockage in the heart arteries? I've been active. I'm not overweight. I don't smoke. Why me? So I used to say, it's genetics, bad luck.
Yeah.
I like that answer, but I could say, and it has been saying in medicine, I had 23-year-old kids coming to me and they have a heart failure and ask me, why me? I'm only 23-year-old. Why my heart is not pumping as well? Other people, my friends, can live their life normally. I could say genetics, but never able to provide actually answer. It's very important for them to know why. And I was frustrated within the healthcare system itself, what we have in Canada, because we become a disease care industry. We are not healthcare anymore. So we call it a disease care. We should change rebrand our healthcare system to a disease care system. Calgary disease care system, Alberta disease care system, because we are looking for diseases and we're trying to manage the diseases. We are not trying to prevent the diseases to occur.
Yeah.
So I shifted my focus in that direction because prevention is cheaper than cure. So if we can keep people healthier longer, then we don't have to give all these medications at the later stage of life, which cost a lot of money to healthcare system. So that what motivated me, that I wasn't happy the type of medicine I'm practicing as a cardiologist. So yes, I can still practice the way I'm doing right now. So I tell them I can be an average cardiologist within the system, the resources the government is giving me. But I can be exceptional cardiologist. But if you want, those resources will include DNA sequencing, microbiome sequencing, looking at certain proteins, certain hormones, which may not be offered by within healthcare system. So that could help me shed some extra light. So that motivated me to come into this area because I want to provide exceptional care. We are Canadians are exceptional human beings. We are so kind, we gentle, we say thank you, sorry, wherever we go, we open a heart. We welcome everyone.
Yeah.
But we have to look after their heart now.
So tell me, you mentioned that it's a global company. How are we in North America I know this is generalizing, but when it comes to heart disease, where are we in North America and Canada and US compared to other parts of the world?
I would say we are way behind. I think the world has been moving. When you come to Saudi Arabia, when you come to Dubai, when you come to various other parts of the globe, they are incorporating genomics into healthcare now.
Uh-huh.
So, for example, so if someone comes in for heart disease assessment, they do traditional testing. Yes, we do stress testing, echocardiogram, heart ultrasound, but they're also incorporating genomic testing with that. They do a VO2 assessment. So VO2 assessment is a predictor of a heart health and also longevity. So they're incorporating those things into everyday assessments. So not just doing a simple treadmill stress test, they want to see a VO2 predictability, which has been shown to link to longevity. So we can then make people healthier and stay them more active. So they're incorporating these genomic-based assay and DNA-based testing, one, to know what kind of gene mutations they have. For example, many people in Canada, every seventh or perhaps 10th person, roughly estimated, has a genetic mutation called lipo-A. Lipo is a type of mutation that makes person make high cholesterol, even though they may not be taking enough too much cholesterol, just making it more. And you may give them statin, but statin is not the right drug. Disease still progresses further. So there are other options, there are expensive options, but at least there are options. So people, we don't even test those things. And there are, besides lipo-A, there are many other mutations in the blood, ApoB, ApoE, many other mutations. We deal with it all the time, or PCK9. If we know the certain mutation people have, then we give them the drug earlier. What the focus is in this part of the world, that when we have a disease, we start a treatment in Canada when the disease happens. Then we say less for treatment. Doctor prescribes aspirin, prescribes statin. Here they're saying is, let's find a way to disease not to occur or delay it. Perhaps start the treatment earlier, even though guidelines may don't recommend it. But their focus is on the primary prevention side. They want to live longer. They want to hit 100 years average lifespan in their countries. So there's a totally different focus. They have a cutting edge technologies, the wearable data, the Fitbit, Apple Watch is integrated into the healthcare systems. And there in Canada, no one even knows what is happening. They have a live telemonitoring happening for the patients, real time. What we have in the hospital nursing unit, they have real time happening in the community.
Mm-hmm.
So the home services expanded exponentially. You can get anything done in a home: ECGs, blood pressure monitoring, blood test to be sample to be taken at home, doctors visiting your home. Telemedicine, digital health has been exponentially growing in this region. So truly, this region is moving in future, and they're living healthcare into the future, moving in that direction. In Canada, we are going the opposite way. So we are denying access, we are limiting access, we are cutting the funding for the testing with the doctors, we're limiting the access to medications. We are going backwards.
Mm. So, what's your background? Like, where are you from originally?
Originally, I am from India. I did my medical school in Russia, did
In
my
Russia?
internal medicine. Yeah, in Russia, I did my internal medicine training in Edmonton, UFA, and my cardiology is in Winnipeg. Spent some time in Cleveland Clinic to learn vascular medicine because didn't want to do it just a cardiology doctor. I want to be a vascular medicine, carotid arteries, arteries the whole body. If you have blockages in one artery, you have blockages in all the arteries. So I
Yeah,
wanted to be more comprehensive cardiologist.
yeah. So, out of curiosity, why did you study in Russia?
Thank you for asking the question. I had an option to study medicine in India. All of my friends who grew up in India,
Yeah.
they all study medicine. They are amazing doctors in India, but I wanted to have a different skill set. I wanted to have broaden my horizon. So when I turned 19, so I spoke to my parents. I got a scholarship. So I said, opportunity. I could be a doctor either way, but I could be a better doctor if I get an international exposure. So that allowed me to learn healthcare system from their angle, their viewpoint. So then I came to Canada, I learned the Canadian viewpoint. So
Yeah.
that allowed me a global perspective.
Oh, okay then. So, and what attracted you to this area of medicine, and in terms of the heart disease and that? Like, What was the interest there for you?
Desire to help people, desire to get people to get the right answers at the right time and without any delay. So
Yeah.
if I could bring the technology solutions into play, if we can bring in the state-of-the-art technologies or testings or things I can use in a more proactive way, so that motivated me towards cardiology. Cardiology usually has been spearheading the innovation cycle in medicine quite often than other parts of medicine. Oncology, rheumatology, dermatology, they have taken recent advances in this area. But cardiology usually has been from day one to take these steps in this direction. So naturally, it made sense for me to do research in this area. So we founded Canada's first $1 million research year called Guru Nanak Dev Ji Dil Research Year at University of Calgary, where $1 million were spent to find solutions for South Asian community. Because South Asian Canadians are at higher risk of developing heart disease than non-South Asian Canadians. So, but just answer, which is every fifth, sixth Canadian probably is a South Asian. So by saying that it's genetics, not providing them support or resources, was not an answer. So I wanted to encourage research in the healthcare system, promote funding for at the University of Calgary, so researchers can learn more about community. Canadians are born here or immigrated, and we can provide better care for everyone.
Mm-hmm. So, you're obviously, you're a doctor, but you're also a businessman, right? And so tell me, how do you juggle both? Do you still have time to do your doctor stuff, or is it mostly business stuff now?
I think it's both. My business is the best business ever. It is saving people's life and making sure they get the right treatment, the right strategies. And intent is always first do no harm. I was talking to some of the royal families here in UAE, in the Middle East, last few days. And the idea is always do first no harm to the patient. If we can't help, can't fix, let's not harm the patient. That's number one. It's very, very important. And so from with that intent, what are the business we have? We try to make sure the pricing is affordable for the patients. We want to make sure that it is democratized access there. Even though we have lots of patents in the BioVero, we have filed over 70 patents over the last couple of years. But we still want to make sure that there's a democratic access. No one should have a control of humanity. So we want people, average person should be able to afford. So that's my business is to genomic testing, and all these amazing technologies are only confined to the richest people on this earth right now. My goal is to make it to get to the masses. So even if I could make a $1 from 1 billion people, it's a $1 billion. That's the best business.
Yeah.
So this then make it cheaper and more accessible and from a global perspective. So I do both. So I do practice medicine. I do see cardiology. By the way, I'm looking for new cardiologists, and hopefully the division of cardiology in Calgary could help me find new cardiologists so I could help make Alberta proud. So I could make Canada proud by deploying this technology, not within Canada health system, but global level. So that will generate a more revenue, more economic output, more jobs will be created in this area.
Yeah. Well, health is big business, isn't it?
Well, we always need it. And health is an investment and not an expense. So like in business, we invest money for success. We should invest money in our health. So if we don't do it, as businesses will fail, if not strategies in place, same way we have to invest money in our health, and we should have a right strategy, and we make sure we follow through. Then we'll be successful for a long, long time. So it is a safe business. I do recommend people to invest into health. I recommend everyone because it improves.
Yeah.
All of us help.
Yeah. So, with all your travels and where you've been and studied, and why Calgary? Why'd you end up here?
Well, Calgary is a beautiful city, amazing people. It's Calgary who made me who I am today. So I'm thankful to Alberta. That's from the bottom. If it wasn't Alberta, it wasn't Calgary, I would not stay in any other part of Canada. So I love Calgary. Why? Because we believe in innovation. We let innovation happen in the companies. We
Yeah.
promote entrepreneurship. We have one of the lowest taxes here in North America. So we encourage competition. We encourage entrepreneurship in health tech. Bunch of yes, we have challenges. Adoption is slow. So for adoption, I have to go outside as many other healthcare companies
Hmm.
before our healthcare system adopts us. So we have to validate our technologies outside, then we get help in Canada. But the innovation cycle and the support what we get from an environment in itself, the talent we have in Calgary is amazing. We are top class city. We just need to support and provide it. And so I would not rate Calgary with any other city.
Yeah.
Yes, they are amazing. Toronto, Vancouver, and Edmonton may be good. Calgary is the best city in my opinion.
Okay, super. So, Doctor, what do you do outside of the business and outside of the being a doctor? Like, what do you do to relax? And do you have any passions, any interests, hobbies?
Well, good question. Someone asked me yesterday, and they talked about what's your story? What do you do? I said, I love meeting people, talking to people, interacting with them, and learning from them, socializing, spending time with them.
Yeah,
So, going art, play, theater, nice meal, dinner. From a sports perspective, I like to go to gym. I like to get this energy out. Sometimes negativity comes in the cycle of any entrepreneur.
yeah,
So, make sure go for exercise and try to get my anger in the gym.
yeah,
So I do that and try to do it regularly when I'm traveling. And if in the airport, I do some exercises in the airport in itself. Try to keep my heart rate going and cardio going.
yeah.
So, so do enjoy movies. I do enjoy Formula One. Driving is my passion. So it could be a Ferrari is one of my favorites. So I do. I'm hoping for them to win one championship one day. So I'm cheering for them. In hockey, Flames the best. One day we'll win the Stanley Cup too. So I'm counting on all of those things.
All right. Well, wonderful. Well, I appreciate you taking the time and talking to us today, Doctor.
Thank you. Thank you so much.
All right, that was Dr. Anmol Kapoor, who is founder and CEO of BioAero. I'm Mario Tonaguzzi, managing editor of Canada's podcast, today with Calgary's podcast. Thanks for joining us.